This is Newa for IT News Africa, and today we're at the 2018 Healthcare Innovation Summit. And today joining me is the Freestate MEC of Health, the Honorable Montsheng Tsiu. How are you, ma'am?
I am well, and how are you?
I'm very well, thank you. Just briefly, could you please kindly tell us how important is it that we adopt to technology within the healthcare sector?
It is actually very important, not just the fact that we are moving to the fourth industrial revolution, but the fact that with technology we can reduce costs and we can be able to provide highly specialized services even to the remote areas of the country.
And currently, could you tell us what initiatives does the government have under place with terms of adapting to technology within the healthcare sector?
Just to set up an example, in Free State, I think even in other parts of the country, we are using the telemedicine that, like with the issue of Mom Connect, where we are trying to reduce the maternal deaths, taking care of the mother during pregnancy, even after delivery, through the use of telephone. So that initiative we call Mom Connect. We also have just launched recently in Free State an ATM-like machine which uses the robotic features to dispense chronic medicines to patients that are under control. But it also helps, it assists the patients to have conversation with pharmacists at 400 kilometers away from them, and it has extended hours because remember, with the clinics where they have to collect their chronic medications, it would be during the working hours where people are working. Now this is at their own convenience, no line, and the person can also access the medication under 5 minutes. You don't have to stand in a long queue just waiting to collect your medication.
And you mentioned something about artificial intelligence during your keynote address and robotics. Could you please tell me, with the rise of machine learning, artificial intelligence, robotics, do you think that within the African context, are we close enough to adapting all of those elements within the healthcare sector?
I think the knowledge is there, but because that it costs a lot, we're still very far as Africa. We are still very far. But I think the political will being there, and with us making sure that we pump a lot of money in ensuring that we use technology, we can get there. But I think we're still very far. In my own opinion, we are still very far. And especially coming from a rural province, yes, we're still very far.
And because we're slightly still very far, do you think that that is just one of the challenges that we are currently facing within the event of adapting to technology?
I think it is, but since we have learned, and I think the fact that there is political will to move and use the technology within the healthcare system, and we have seen its benefits, we will definitely get there.
And lastly, why is attending summits like these so important, whereby we bring together the private sector and the public sector to meet under one to discuss such engaging topics?
Because we have since learned that, collaboration is something that helps. We cannot go alone as the public sector and private sector do something else, because that causes fragmentation in giving health services. And this is the inequality that we talked about, where you find that the public sector has to take care of so many patients with limited resources, but most of the money goes to the private sector, who have to take care of less than 20% of the population of Africa. So collaboration, bringing together private and public sector, it's a wonderful thing, because now we're going to be exchanging and then learning about the good initiatives that we can also implement, and we can also see how both of us, private and public, how can we ensure that we improve the healthcare systems within the country, working together? Because in any case, our goal is one. We want a healthy nation, so why not work together? Let's make sure that we do away with the fragmentation and have a seamless collaboration between the public and private health sector.
The Honorable MEC Montsheng, thank you so much, ma'am, for joining us today. It's been a pleasure.